Today our patient has a little bit of a scoliosis and some rib restriction, and we're going to work on her full spine and do some special attention to her rib cage and particularly the movement with the breath. And when we start, what we want to do is always just get a visual and see if anything jumps out at us. And here is where we see the most asymmetry. As usual, having some consequence on the positioning of the scapulae, with the right one tending to be more protracted, as the thoracic curve is almost always going to be convex to the right. That's going to push that scapula out. And what I like to do is ask my patient to raise both arms over their head, and really reach for the ceiling. And that does bring out the rib asymmetry a little bit. And give us a nice deep breath in, please. And breathe out. Good. One more time. Good. Okay, and we can see a lot of the breath coming up into the upper thoracic spine, and we're going to want to induce a little bit more movement through the lower ribs in particular. You can let your arms down. Thanks. So we're going to start with you face down, okay?
Okay.
With the patient prone, relaxed, I like to do some gentle joint play assessment. So it's just a little bit of a rocking, giving a tiny little bit, couple degrees of rotational play. As I induce that with my left hand, and with my right hand, I'm palpating up the spinous processes and feeling for where there's a resistance or a lack of joint play to that simple rotation. That usually gives us a pretty good idea of where the tightest areas of the spine are. And on her, it really corresponds to the apex of her curve in the middle thoracic spine right here. And then as we get into the upper thoracic spine, the spine itself is moving pretty well, but I'm keying into some upper thoracic and cervical extensor hypertonicity. So that's also on my radar. Let's get a little oil on our hands, and as usual, just some gentle traction on the sacrum, on the pelvis. Just an easy stretch of those iliolumbar ligaments and lumbosacral ligaments. Heels of my hand coming into the lumbar erectors a little bit. Nothing aggressive, nothing hard. Just kind of saying hello. Always looking for circulation and mobility. Coming up now more into the rib cage. And I like to visualize that fascia between the rib cage and the skin as like a tight shirt. And I want to stretch it up. I want to make sure it has good mobility in this inferior superior direction. So you can see I've got the skin, and I'm pulling the skin, and I'm pulling the tissues overlying the ribs as well. Right about here, we're starting to feel some of those serratus anterior slips, and they're a little bunchy, which is very common. Good, nice deep breath. Good, nice. Already starting to see a little more mobility through the lower ribs. That was a really good breath. And let's work this thoracolumbar junction. Good. Now, none of this is to the level of the bone. We're really kind of in that fascial layer between the lower trapezius, as you can see the border of it right here, and the erector spinae. Just trying to get mobility through all those layers. Good. Nice breath. You can see a little trigger point here. Good. Now I find that when the ribs are tight like this, it's very hard to get a good adjustment on the thoracic spine. And so I'm not going to try. I know what's going to happen is that it's just not going to feel very good. So we're going to focus more on rib mobility next. And for that, we'll have our patient side lying. Since the right side is tighter, we're going to start working on her right side, which means laying on your left facing the door, okay? So we have our patient side lying now, which gives us really nice access from the iliac crest all the way up to the scapula. And I'm really interested in this section right here. So I want you to take some deep breaths, really nice. And I want to instruct my patient to breathe into my hand. We're going to do this a few times. I'm providing just a little bit of downward pressure on the ribs. Gives her something to push against. And what I want to feel for is expansion in the A to P direction, in the lateral direction, and also an opening or like a fanning of the rib cage, and let that out. And in these lower ribs right now, that feels really quite good. Breathe in again. Good. Just feeling a little bit of restriction here. So I would say that's probably ribs 6 and 7 in the intercostal tissues. So this is going to be pretty sensitive, which means we're going to take our time and be gentle. And we don't want to dig. So flat fingers, no poking. Keep breathing there for me. Good. And as she does, I want to induce separation of this 6th and 7th rib. By my count, 6 and 7. Deep breath. Very nice. Particularly right here is where it's stuck. Good. Very nice. Good. Good. Just one more. Good. And let that out. So I'm going to follow these ribs around to the lateral aspect here, under the latissimus, between the latissimus and the serratus, right here. And you can often feel this border between the lat and the serratus being a little adhesed. It's usually a matter of getting a little bit of a grip on the lat and pulling it posteriorly really gently. That long thoracic nerve runs right through there, so we want to be careful. But because that nerve is there, we also want to make sure we have good freedom of movement. How are you doing?
Good.
Good. Nice deep breath. Really good. And let it out. Good. Now to look at the thoracic spine in this side-lying position, it's going to raise the table a little bit. You can see with my thumbs and the palms of my hands giving a little compression to the rib cage as in an exhalation, plus a little more. And I'm feeling for the spine to adapt or really deform to that movement as I do. And again, as we get into her middle thoracic section where the apex of the curve is, it's kind of resistant to that movement. So as usual, my first line of thinking is, can we manually induce some of this movement? And I want to remember that the spinous process that I can feel is only just the tip of the vertebra. And the vertebra, the center of the vertebra is in, just like 2 inches deep in her body. So that's really where I'm aiming my movement, is not just to push the spinous, but to get some movement through the vertebrae. And I'm feeling like we're able to induce a little bit of that. Another nice deep breath. Good. And let it out. There's really nice rib mobility happening right now through this middle section, which is great. I'm going to take your arm, okay? So as I come into the upper thoracic, you can just let your arm rest right in my hand. I totally got you.
Okay.
Yep, make it heavy. A little more. There you go. Okay. So inducing a little retraction of the scapula and feeling for the ability not only of the scapula to retract, but also of the rib cage and the spine to kind of get out of its way. Feeling a little bit of a hang up right here, rib 4, maybe rib 5, right where it comes under the scapula. There's a little bit of rhomboid going on right there as well. And we just work through that really gently. Good. Now just an easy mobility of the ball and socket of the shoulder. Just a nice little pivot. And then a gentle abduction stretch. We should be able to feel that stretch all the way down through the serratus to the bottom of the rib cage. That's okay in your shoulder?
Yeah.
Yeah. If there's any pinching in the shoulder with this, then it's a little too much. And it's nice to really support the proximal humerus here so that you get that stretch directly into the shoulder joint. And there's a little external rotation happening with this stretch as well. Well done. Working on her left side now, and we're going to go through a very similar process of feeling for mobility, the rib mobility with the breath, the thoracic mobility with the rib, and the thoracic mobility with the scapula. So give me a nice deep breath in here, pushing into my hand gently. See a really nice front to back expansion with that breath. And there's no arching going on in her back with that. Sometimes people will give themselves a little more room to breathe by arching their thoracic spine, which is okay, but it's not really ideal. What we want is to see that rib cage be really flexible in the front to back direction. Also, as she breathes in, raising toward the ceiling, which is happening nicely, and you can really see the ribs fanning as she does that. So, really nice job. So this just basically brings me back to that serratus and lap order here on her left side, right there. You can see the adhesion kind of chunking under my finger right there. And this one comes down a little lower on this side to be kind of even with her most prominent rib. And again, I'm just following that rib and intercostal with my thumb and getting a little separation between the serratus and the lat. And now feeling again for that rib-thoracic interaction. As she breathes out, I compress a little bit, and I want to feel if that thoracic spine is okay with that, basically. And so far, so good. Maybe a little bit here around T9, 10. And a deep breath, please. And as you let it out, I'm just going to give a little bit of pressure. There's no thrust, there's no cracking with this adjustment. It's really much more of an induction, and it just needed one. Nice deep breath again. And breathe out. So our patient is in really good physical condition. Her body only needs sometimes just a suggestion, a little reminder of what to do. Can I have your arm? Thanks. Just rest it right in my hand. It should be floppy. Good. Beautiful. And in this scapula here, again with the retraction, there's a little hang up right here in the rhomboid around rib 4 or 5, same as the other side. Good. Beautiful. I'm going to bring your arm up over your head, okay? Okay. Let me do it for you. Just let me know if it feels pinchy. Okay, a little bit more resistance on this side to a inferior glide of her scapula. You see as I traction posteriorly through the humerus, I'm inducing that downward and backward movement of her scapula, and it feels a lot smoother now. Good job. Are you left-handed or right-handed?
Right.
Righty. Well, that's how we assess and treat the thoracic spine and the rib cage and the relationships to each other and those relationships to the shoulders in general, in everyone. If the body has a scoliosis, it just becomes a little bit more different angles, different areas where the stress tends to accumulate, but it's really basically the same thing, and that's no different for her.